Hello and welcome to another episode of Unique Professions. I have someone here today who has a story to tell, and I'm not going to say much more than that. In fact, I'm going to let her tell her story. Stacey, how are you?
I'm good today, David. Thank you so much for having me.
Now, Stacey, what is your story?
I am a doula.
Okay, can you tell us what that is?
A doula is a person that holds space for women. They hold space both emotionally, physically, and through providing resources for women in the both birth space and also during the postpartum period. Yeah.
Can you explain maybe what the postpartum period is?
So after the woman has had the baby, it can be during breastfeeding, when they've gone home. Sometimes, when women get home, it's a time where, nobody gives you a rule book when you've had a baby. And so you're at home, you've got this beautiful little human being, and basically you're trying to navigate this new world, this new identity as a mother. And, if you look back in thousands of years ago, we used to be surrounded by women. We would have our village around us. And then even, if you think back in the 70s and 80s, women were at home and they would have, other women around them. Whereas now, these days, a lot of women, they have to go back, the husbands have to go back to work a lot sooner, and the women also have to go back to work a lot sooner as well. And also you've got, we've got a lot more people from the UK and Ireland over here, and they don't have those family connections that you would once have. And so in that postpartum period, it can be lonely, it can be isolating, and women don't always know how to reach out for help because there's that stigma that women should know how to do it because they are mothers. So the postpartum doula comes into the home and they can hold space for the woman. That might be cooking meals, it might be doing a light bit of housework, it might be just sitting there having a cup of tea with the woman, listening to them talk, listening to how they're feeling, holding that emotional space for that woman. If they're having a down day, if they're feeling like they need extra support, like lactation consultant, things like that, we can find them resources, we can find them connections, help them out with that. Some postpartum doulas are actually lactation consultants themselves, and they can help out in that field. I myself am not, but I would then go and source out a lactation consultant for the mother. But yeah, it's just holding space for the family. They may have toddlers at home. They may be finding it really hard and, want you to interact with the toddler so that they can feed the baby. They may want you to stay with the baby so that they can go out and have a walk and get fresh air. They may want to just wash their hair. They may want to have that time just to wash their hair and have a nice shower. We do all sorts of things. It really depends on the mother and the mother's needs and where she is in that time and that space. And it's a really beautiful thing to be able to offer that service. Yeah.
I guess with that service, obviously you consult with the mother
Yeah.
and their families and find out what's best for them.
Yes, definitely. Yeah. Every situation is different depending on the individual. Yes.
Now, you said there that you hold space. How important is that for you, holding the space?
Very, very important. You need to, read not so much read the situation. You need to be able to. I'm very intuitive myself. I'm quite intuitive. So, and I'm very heart centered. So, when I go in, it's about not putting any expectations on that mother. Going in, finding out what they need and being able to gauge the situation. If you go in and they might seem, particularly flustered on that day, then, you may say, hey, sit down, can I do this? Or what do you need? It's about talking to them and asking them what do they need, you know? Yeah.
So how did you actually discover the work of being a doula, and how did you start your journey?
I've always been interested in birth. From a very young age, I entered the world quite traumatically. I was 3 months prem, and I was also a twin, and my twin passed away at 2 months old. So I actually entered the world quite traumatically. So I've always been fascinated with birth. I wanted to be a NICU nurse to start off with, and then it kind of switched to wanting to be a midwife, and I would always look at home birth and water births, and I was absolutely mesmerised with water births. And then I was diagnosed with epilepsy when I was 20. And so it kind of took a bit of a different turn for me, where I thought, well, I'm going to be having my baby in the hospital. And so when I had my son, I remember that the midwife, there was handover in the middle of the birth, and I had built such a good connection with that midwife, and I didn't want her to go because she was just so good at keeping me calm and working on my breathing. So it was that moment that I kind of realised that I don't think that I could do that work. I wanted to be there from start to finish. That's the kind of person I am. I like to see the journey through. So that's when I decided that I would much rather be a doula rather than a midwife. Yeah.
And you said there that the journey from start to finish, and that's really important, being a doula. How do you find perhaps the mother, the different changes from start to birth? What are some of those different changes that you see?
Well, I find it really all depends on the mother. Like, you know, with my journey in particular, like it depends on the mother and where they're at. Like with the importance of having a doula, like we have such a high birth rate of birth trauma. There's 1 in 3 women who have traumatic births, and a doula is so pivotal in helping reduce that. And so when a woman comes to a doula for, her services, we go through birth plans, we provide that continuity of care, we provide them resources. If they have like things prop up in, like gestational diabetes or high blood pressure, or maybe they don't want to use pain relief, induction, all these things that can prop up. Let's say they're having a hospital birth or, a medicalised birth. The doula can help them look at different choices. So it's about providing that continuity of care and about providing those different choices for the mother so that they can go in and they can advocate for themselves. The doula's job is not to advocate. It is the mother's job to advocate for themselves. So that at the beginning, you might find the mother's not really sure of what she wants. She doesn't really know. And so then we can as a doula, I would go through, different options, whether they wanted pain relief, whether they wanted to have an epidural, whether they just wanted to have gas and air, whether they wanted a totally physiological birth and wanted to look at hypnobirthing. And it's about empowering that mother and making sure that they have the best outcome possible so that they feel, confident in their outcome. Yeah.
And I guess, being obviously when the mother is at home, and like you were saying, it could be anything that the mother wants, depending on the day, shower or a walk or anything.
Yeah.
How do you engage in that kind of conversation? Say, do you just ask and say, look, what do you want me to do today?
Yeah.
Is that pretty much?
Well, usually what we meet with the mum beforehand. So if they're having you for just a birth doula, you would meet with them, beforehand, and then we would meet with them twice before the birth, and then you would be there throughout the whole labour, and then you would touch base with them after the labour. If they wanted you for the postpartum period, that can be up to 6 weeks. So again, you would sit down with them, you would make a plan beforehand, and you would say to them, what is it that you are needing? Like, are meals your priority? Do you not want to have to cook? Is it that, do you want to get out of the house? Do you want me to help with the kids? basically in the postpartum period, you're pampering that mother. You want their job is to heal, and their job is to rest and restore from their birth. It's been a huge thing. They've been growing a beautiful human for 9 months, and when we go into that postpartum period, we're go, 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 go. We forget to stop. So, when the doula comes and steps into that space, it's just allowing them to stop and rest and, and connect with their baby and, all the things, yeah.
And I guess that healing process that you just talked about, that's really important, isn't it?
Yeah, definitely. Yeah, I know it was for me, definitely. Like, I know... and it's a hard thing. Like, I remember looking into a doula and looking at the price and like I didn't feel worthy of that. And that's sort of been something like if you look at the 5 themes of birth trauma, it's, feeling abandoned, feeling powerless, feeling insignificant, feeling like a failure, and feeling like there's a threat to your safety. So, if you look at all of that, when the husband goes off to work, like the mum might feel abandoned. She might feel powerless, like she's not good enough. She might feel like she's insignificant if she's having trouble breastfeeding. She might feel like a failure. All these things, and this can pop up, in the, the prenatal, during birth and postnatal. It can pop up at any time. So that's why a doula is so prevalent, in that they provide that continuity of care. They are basically there holding your hand. They are that person you can call on. They're basically on call. They're like your birth coach, basically, whereas with a midwife, if you're in the hospital, let's say you're in the public system or the private system, you've only got those sporadic appointments. You haven't got that person that knows your emotional needs inside and out, that knows, if you've been through trauma in the past, that knows, what it is that you're really needing. Yeah.
And you said that you're a very intuitive person.
Yeah.
How does that help, or how have you found that to help, being a doula?
Basically, it's picking up on how that person is feeling on the day, and they may not always say how they're feeling. So,
body language as
yes, yeah, definitely the body language. It's, you may walk into the room and someone may say that they're fine, or, it's, people don't always say what they're feeling or say, and so it's important to be able to read that body language and to be able to pick up on the energy in the room. Yeah, definitely.
And how, with the energy in the room, that's very interesting. How do you kind of approach that? Is that the same sort of process?
Yeah, definitely. So, I would say I'm quite a gentle personality. I'm quite, with my language and in my approach, and it's just about doing those little things. Less is more. Mm-hmm. Yeah, less is more.
And you said that, when you had your son, you went through the midwife process, and then you kind of found doulas. Do you find that a lot of people, or a lot of mothers or expecting mothers, haven't heard of a doula before, or how have they found you?
Well, I work at a hospital, and I'm still educating people to this day, like telling them that, I'm, establishing my business. I'm working as a doula, and you get some that say, oh, great, and then you get quite a lot that say, what's a doula? It's when you look, like I said before, it's something that's been done. Women have been around women for thousands of years, and it's not really a taboo thing anymore. No. It's women are needing this support. It should not be a luxury. It's not something that should be a luxury. It's actually it's a necessity. It's a necessity that we need because, especially in the hospitals, there's not enough support for the midwives. If you think the midwives, they're looking after the mother, but they're looking after the midwife, the baby as well. And, it's They do an absolutely incredible job. Like, they do an amazing job, but they've technically got two patients. So, they can't always spend the time with the mother that they need. So that doula just provides that support. You can message them, if you're in hospital, they can come in and see you, yeah.
And do you think, being a doula, do you think it actually helps the bonding of the mother and the child as well?
Yeah,
And
definitely.
with that whole attachment theory as well.
Yeah, definitely. So, you can, there's so many options that doulas can go through with the mother. So, you can go through making sure there's skin to skin straight away, especially if like there's a C-section, making sure that the screen's pulled down, making sure that the baby is put on the mother straight away. If, the baby has to be taken away, then, making sure dad gets skin to skin straight away if the mother's not well, or there's so many scenarios that the doula can go through that the mother may not be aware of. And it's also that, it's also the mother's right to say, this is what I want. Like, the hospital may say, we want to do A, B and C, and you can actually say, well, thank you, but no, this is what I want. Like, no is actually a full sentence.
Yep.
And, the hospital, they can document mother refused,
Yeah.
and they can, so there's all sorts of choices that the doula can go through, about making sure that bub gets on breast straight away, making sure that there's skin to skin, making sure that bub is not weighed straight away, bub doesn't have any observations. Like, it's not going to matter if it's done straight away or like in an hour if everything has gone well. Yeah. Yeah.
And how do you find advocating for, like you said, the midwife or the hospital might say,
Yeah.
hey, we want to do this, and like you said, they might just say, refuse patient. How do you find advocating, in that hospital setting?
Yeah. I haven't personally done a hospital birth myself,
Yep.
but from what I've heard, there is pushback from some hospitals. That we do find, like, some doulas, they have gone more towards home birth now, but I personally would like to, that's something I would like to see changed in the hospital setting, because doulas are not there to ruffle feathers. Doulas are not there to, make waves or make anybody's job any more difficult. Doulas are just there to support the mother, while the mother, like midwives, they've got 5 different patients. So they may be with that mother while, whatever's happening, but then they're going out into 5 different other rooms. And if the mother, again, like, the midwife might walk out, the mother feels abandonment,
Yep.
and then there's that risk of, birth trauma if they're feeling that. Doula's in the room with the husband, can reassure the mother, you're doing great, keep breathing, change of position, all I could go on for days.
Yeah, yeah.
So many things that, and the doula is there to provide that support, to be with them 24/7. Whereas the hospital they can't provide that. They haven't got the resources.
No. And one thing I'm wondering is, when the mother is pregnant
Yeah.
and hasn't actually given birth yet, what kind of support does the doula do in that regard?
So that was when we would go through
Yep.
all the resources, the birth plan, things like that. We give them a bit of pampering as well. We always like to give them a few little treats, things like that. And but it's mainly going through the birth plan, getting really clear on what they want for their birth, how they want their birth to feel. That's the main thing. Like, how do you want your birth to feel? Like, how do you want to feel afterwards? And then going through, okay, how can we achieve that? And working through anything that's, any fears that they've got, any anxiety that's maybe arising, and, whether they want to go and do a hypnobirthing class to help with that. Yeah.
And with the birth plan, I know each birth plan is probably really different, but can you kind of like maybe give a brief outline of what you would like to include in a birth plan?
Yeah, so if you have a mother that wants to have a physiological birth, there's Catherine Bell has a really great book called The Birth Map, and she talks about doing, like, you basically have different scenarios. So you might have if it's a physiological birth, like, so they may just start off with hypnobirthing, breathing techniques, things like that. And then if you move on to the next stages, so you might want to have an epidural or, but it's, and then if you want to have like a C-section, it's working out those different stages and what the options are for like those different stages of birth. So it's also important to use working out the risks and the benefits. What happens if we do this straight away? What happens if we wait? And, is there any immediate risks or is there not? And, weighing up those risks and,
So a bit like a pros and cons kind of thing,
Yeah, definitely.
And now you said you're establishing your business at the moment.
Yeah.
What kind of services are you hoping to provide?
At the moment, it's mainly postpartum. I've got 3 young kids. I've got a 7-year-old and twins, so 5-year-old twins yesterday. So I'm just trying to juggle that at the moment because being on call can be quite tricky.
Yep.
So at the moment, I'm just working on my postpartum services. But having epilepsy myself, I am really passionate about advocating for women in hospital who, may not realise the choices that they have. I know definitely in my experience, I went along with the medical professionals because I thought that was my only choice. So I want women to know that they have choices out there. So for me, it's about educating women at this stage with birth and then also providing those in-home postpartum services.
And like at the very start of the conversation, you talked about the historical context where women have always looked after women before. Why do you think maybe now that we've kind of lost touch with that a little bit?
Well, the birth system has just become so medicalised, and it's about basically people think home births are dangerous, and they're not. It's women, our bodies were designed for birth, and somewhere we went away from that. It was gone into the hospital system, and I don't like to say men, but the doctors, introduced medication, things like that, and we just went away from what women's bodies were designed to do, and women were, I don't like to say taught to believe, but basically that they couldn't do it, and they needed the assistance of the doctors, and they needed the assistance of the medication, when really, if you look intuitively in your body and you trust your body and your instincts, which has been a big learning process for me personally, your body can do amazing things.
And how do you encourage that with the women? Teaching that strategy of the body can do amazing things.
It's basically sitting with them and just talking to them and, finding out what's coming up for them and maybe what fears are coming up for them and then moving past those fears. And, like I said, giving them resources, podcasts, giving them lots of positive stories of, you can do this. There is plenty of women that have done this before you and you can do this. But again, it depends on the individual.
And I know you're a really big advocate for educating women, and especially when we just talked about, some people, don't know what a doula is. Some people may have been enlightened. But it's really about education. What are some key things that you take away messages for women that are maybe considering a doula or don't know the options?
Well, basically, with a doula, like I said before, that continuity of care is vital. And so whether you're doing a home birth, community midwifery program or like birthing centre or a hospital, that doula is with you on call 24/7. They sit with you. They find out what you want for your birth. They then go and source out the best way for you to achieve that birth, help you advocate for your birth so that you feel empowered and you feel strong and you feel amazing that you are able to do that. Help your partner do that as well. Educate your partner so that he feels confident and he knows what's going on. You know, I also recommend, you know, it's good for partners to go and do private birthing education classes.
Yep.
So they just, you know, find out the mechanics of what happens in birth and, you know, early labour, things like that, you know, you don't necessarily get taught. So, yeah, that doula is basically there to find out how you want your birth to feel and yeah, help you achieve the best outcome possible and have a positive birth experience rather than have a birth experience that may go a way that you don't want that direction to go.
And yeah, obviously you want to avoid the traumatic experience.
Yeah.
Because a lot of women who have had traumatic births, and I suppose as a doula, obviously that's not what you want.
Yeah.
You kind of want to empower the expectant mother or the mother to be, and with those sort of relationships and like being on call, can plans change during the birth?
What's that with being on call?
Let's say a mother, I'm just going to give you an example here. Yeah, you do a birth plan.
Yeah.
Things are going okay.
Yeah.
But then the mother goes, oh, hang on, I want to do something
Definitely.
else.
Yeah. Yeah, and that's the mother's call to make, you know, and that may, you know, the doula might not agree with that, but that is the mother's call to make, you know, and we can only educate and we can only help them advocate for themselves, and that's why we do all the prep work beforehand.
Yeah.
And then, you know, it's completely up to the mother and it's their call. They may find that they're in the birth and, you know, they wanted a physiological birth but they're not handling the pain and they want an epidural, and that's fine. That's complete. It's not for us to say. We're there to support and to guide them in whatever decisions they decide to make, and we will always do that. Yeah.
Now, I know you were saying that it's getting a little bit better, but there's still a lot of pushback from hospitals and things like that about your role.
Yeah.
Do you think maybe education, not just educating, midwives and doctors is also important as well? And perhaps, somewhere along the lines, maybe a collaborative approach can work.
Definitely. I think we need to educate doctors and midwives on birth trauma as well. There is by far not enough, you know, education. I was talking to someone the other day and I was telling them that birth trauma can happen, you know, before, during and after the birth, and she was a professional and she was like, oh, really? And I was quite floored that she was not aware of that. I mean, I know it was definitely new for me when I did my training. I actually, I would say I definitely learnt all of this in my training. I was not aware, and so that was quite a healing journey for me, because I then went on my own healing journey and healed my own birth trauma that I was not aware of. So now I am a huge advocate for making sure that you know, I can reduce birth trauma as much as possible, and I can be a strong voice, you know, in helping women advocate for themselves.
I know hindsight is a great, beautiful thing, but we've all been there and done that. If you had that knowledge, what would you do differently in your own birth?
So with my first birth, the main thing for me was the communication. So, you know, my son's heart rate was dipping, and I basically was, so with epilepsy and the medication, they kept sending me to get his heart rate checked, and I kept saying, it's going to be a C-section, it's going to be a C-section. They just kept saying, why are you saying that? So nobody had informed me on what was going on. That was the main thing. So that's where a doula can come in handy, because they will talk about what's going on and inform you about why they might be getting the heart rate checked and things like that. And a doula, I must say, doula is not a medical professional. We are not medical professionals, but we could go and find evidence-based research, and then we would give it to the mother, or we would get a book or a podcast, or and so in my head, I I basically had that it was going to be a C-section. I was convinced that my body was going to fail because I'd had seizures constantly. In my head, I was like, there's no way my body's going to do this. My body can't do this. Like, it's going to fail me. So having a doula there, that doula would have been able to, we would have worked through that fear and, done breathing. I probably would have had calming music. That's something I definitely would have changed. I had what's it called? Do you really want to hurt me?
Oh, yeah. Yep,
And I had all these funny comedy songs.
Yep.
So the mood was probably not right.
Mm-hmm.
I thought I was going to have this.
Oh, yeah.
I think I thought I was just going to walk in there and have the baby. It was going to be great.
Yep.
And that didn't work. And, and then also because I'd had, my twin sister passed away, and that was a traumatic entry to the world. My mum was at the birth, and I think subconsciously I was like, I'm going to have an amazing birth. It's going to be. I had an emergency C-section. It all went to crap, and I was vomiting. And then my mum was over at the window trying not to dry reach, and it was just. So I definitely would have hired a doula because there was a point where his heart rate was dipping, and I said to the staff, "He's not happy," and they went, "Yeah, he's not." My brain went, he's in danger, I need to get him out. So there was a perceived threat there. So, the fifth theme is, threat for safety. So there I've already got two, So there was, they may not have seemed big at the time, but when you work through that, communication is a huge thing. And staff are they're in there, they're doing their job, they're going from room to room. When you've got that doula present at your side, talking to you, taking the time, they're your sole focus. They're only focusing on you. They're not focusing on 5 other women. They can actually, help you calm down, go through your choices. Yeah. So, and then, with my twins, I had complications with the twins, and so my husband had to go off with one of the twins, so I was on my own in the operating theatre. Because I lost a lot of blood, I'm guessing that my blood pressure must have been dropping or something, and I felt like I was going to pass out. It was awful, and I was waving my hand trying to get the anaesthetist's attention, and he was talking to the nurse, totally unaware of what I was doing, and it took him it felt like a good 5 minutes. It was probably only 30 seconds, and then he came over, and I said to him, I'm not okay, and I heard him say to the doctor, we've given her everything we can give her, and he said, don't worry, it'll be over soon, and he went and sat back down, and I was on my own, just dying for it to be over, basically. So first one is abandonment. So I felt abandoned. So when you can have a doula, you can have on your birth plan, if my husband has to go off with the baby, I want my doula to come in and sit with me so I've got someone with me.
Some support,
You could have that doula sitting with you, holding your hand. You're okay. Take deep breaths. Just take deep breaths. You're okay. You're doing great. You're doing amazing.
Someone to reassure you and comfort you during that process.
Yeah.
Now, you did say I was going to actually tackle this a little bit earlier. It was in my thought process that doulas it's not medically trained. But where did you get your training from, and how is that kind of recognised?
So doulas are not governed. Anyone can technically go be a doula. I trained with the Doula Training Academy by Vicky Hobbs. Amazing woman, so full of knowledge, incredible. That's where I did my training. It was a 2-week intensive training program, and then there's 13 modules after that. So and we had an array of women come in as guest speakers. We had Belva Diglioni, Pip Owen, Faye came in. Her last name skips me. She was an incredible midwife that also is intuitive, like psychic, and that was amazing. But the guest speakers were incredible. It was 2 weeks of jam-packed knowledge. Like, it blew my mind, absolutely blew my mind, and sent me on a sideward spiral of probably 2 years of healing, and then I came back round, and here I am.
Yeah, excellent. Yeah. And I just want to touch base with that kind of, when you were doing the training, did you do like something like a, practical experience?
Yeah, we did. Yeah. We had 2 different women on one day, and they came in, and we did some OMP, optimal positional maternal positioning. That's where you work with the women and some different massage techniques and things like that. And we went through birth choices and things like that, and just had a chat with them, and just did a lot of practical massage skills that we had learnt. Acupressure as well. We learnt some acupressure points. Yeah.
And how important, you just brought up massaging and making that person comfortable while, in the hospital or at home.
Yeah.
How important is that as well?
Again, that's up to the individual. You might find some women don't want personal touch.
Yep.
Some women may really love it. It just depends on the individual. Yeah.
And I guess, with the home births, and like you said, they're not, dangerous or anything like that.
Yeah.
Why do you think there is a bit of stigma around home births?
I think because people feel like they're not safe. Like, what if something happened? Like, I know definitely I felt like I couldn't have a home birth because of my epilepsy. But if you look at the stats, like, if you haven't had a seizure in over 12 months, you've got 90% chance of having no complications.
Yep.
So technically, I now feel like I could have had a home birth, and it would have been far better for me because I would have been at my home. It would have been calm. I love the water, but I mean, I don't know whether I haven't technically asked a midwife, but water and epilepsy, I don't know whether they would feel comfortable, but I could have stood in the shower. I would have been in my own environment, and it would have been a lot calmer. But it's because you're in your own environment. It's not you're out of that clinical setting, so your brain is not perceiving that threat. Some people, they go to a hospital and they perceive it as a threat. I'm sick, I'm in hospital. So the home birth can be more of that, that natural environment.
I guess even with being a doula, and doing home, if you've got a mother doing home birth, perhaps you're less restricted by, what the medical team and does that make your job easier and your relationship?
So you would work with the midwives, and after when the baby's born, you can take the mother over to the bed, you can make her a cup of tea, get her some food. If there's other siblings present, they can come and sit with the mother as well, and it's just a lot more inclusive.
Are you actually, I suppose again it depends on the mother's choice, as we all know that. Are you actually not involved in it, but are you there when the mother is giving birth?
Yes.
Yep.
We're there from the whole process. From
Okay.
the start until they're finished.
Yep.
Yeah.
And how's that process? Obviously it's very special,
Yeah. I haven't personally been to a birth yet myself, so
But I'm sure you'd love to at some point,
Oh, definitely, And from what I've seen, like videos and but it's not something I've had the honour of doing yet. I would love to. I would absolutely love to hold space for a woman, giving birth, but it's not something that I've had the privilege of doing yet.
Yep. That's good. All right. Now, when you decided, to become a doula, and with that whole education, how did you start educating people? Say, hey, look, this is my journey, this is what I've been through, and this is what I've been called to do.
Yeah. So at the moment, I'm just trying to get more out on Instagram, and when I see people, I'm just talking to them. Yeah, because that's the main thing. It's just talking to women. Like, this isn't, I feel like it's not information that should cost money.
No.
It's out there, so it should be free to all women. So it's just about getting out there and sharing the information, especially, with epilepsy. Like, so with my second birth with the girls, with my son, I had trouble breastfeeding. I personally believe that it was a latching problem, but I was petrified that it was the medication in my system. He would have been getting a lot more in the placenta than he would have been getting in the breast milk. But I was so fearful of that. Again, if I'd had a doula, I probably would have been able to work through that. Hindsight is a beautiful thing, as we said.
Yeah.
The King Eddie's Hospital has a pharmaceutical line that you can ring. And so with my twins, I rang the pharmaceutical line and I found out the amount of medication in the breast milk. So my first medication, I think there was 25%, and the second medication, there was, I think, 10%. So I made the informed decision of not breastfeeding because that's a lot of medication, I thought, when they were going to be born 5 weeks premature. So for me, it's about educating women, especially women who may not know, who have, who are deemed as high risk, if they have epilepsy or other conditions. It's making sure that they know the facts and they're educated and giving them that reassurance. And, so if anybody is interested and wants to, wants to find out information or would, like to touch base, I would be honoured, and I'd love to help you on that journey. Yeah.
And I'll certainly put up your Instagram link when this is released. Now, I just want to, with the me being a male, and we've talked about the male being present in the birth.
Yeah.
What advice would you give men who are trying to support their loved ones or their partners? What kind of space do you hold for them?
I think it's important for men to be educated as well, so that they know what's happening, so that they can know how to support and hold space for their wives or their partners. And, also it's important to know that what the choices that they're making going into the birth, but also that, that choice may change for the woman, and that's okay, and just to hold space and to be there for her. Yeah, and it's also, it can be very confronting for men, because that's a time where the man can feel quite helpless.
Yeah.
Because it's the one time where he can't do anything.
Exactly.
He's just there holding space and supporting that woman. And it's, something that, it's a journey that they both, haven't been through. And men can go through birth trauma as well, as much as women. So that's something to be mindful as well. So, and we need to hold space for them as well if that's something that happens. I don't mean to be harping on about that, but it's just something that needs to be brought to light and be aware of. But, men definitely deserve, that respect and, that knowledge so that they can best support their wives in the birthing space.
Yep. And I guess it's that fear of the unknown as well.
Yeah, definitely.
That people tap into, especially if it's your first birth,
Yeah.
And like you don't know what's going on. Perhaps if you've been through the process before, you might be able to gauge what's actually going to happen.
That's why private birth education classes are so important. Vicky Hobbs does incredible ones. So does Pip Owen as well. Pip Owen's a registered midwife. And Vicky Hobbs has been a doula for many, many, many years, has a wealth of knowledge. And I've lost my train of thought. So that's why it's important that men... the partners go to these
birthing classes.
Birthing classes, because when you go to the hospital, what they tell you is these are the medications we can offer you. These are the tools we may use, like forceps or this or that, or this is what the hospital room looks like. Like, whoopee.
Yeah, we can see pictures.
It's a bed. You know what I mean? They don't actually tell you. This is what early labour feels like, or like this, this is what the woman's body's going through. Like for me, for instance, when what I learnt in the doula training, like when my son's heart rate was dropping and going up, well, the body's contracting. So the baby's being constricted and then it's coming back again. So it's pressure on the baby. So that's going to happen at certain points. but again, there was no communication there. So that's why it's so important for both the wife and the husband to feel empowered and know, what's happening in birth and not going in blindsided. Yeah.
What makes a good doula?
Oh, that's a hard question.
Yeah. Because, I was probably thinking, if I'm thinking about, you have to be fairly patient, I'd say.
Yeah.
Yeah.
I would say, that's a hard question. Someone that is able to hold space, someone that goes in without judgment. I would say someone that goes in with an open heart and accepts all,
All different experiences, all different people.
Yeah. Like I know that there's certain movement in the doula industry at the moment where some people are will only accept home births.
Yep.
They're only accepting home births or they're only doing free births. And I completely understand why that is. And maybe they're doing that because, look, I've not gone into the birthing space yet, but from my personal experience, being a high-risk birth, those are the women that need the support because if you're going in and, that's where you feel safe in the hospital or that's where you, for certain reasons, you might not be allowed to have a home birth and you have to go into the hospital, they need that support. They need to know that you may not have the choice of being high risk, but it does not mean that you don't have choices. So I would say, definitely having an open mind and that everybody deserves to have a doula no matter what your situation is.
I guess one thing, I think being a doula is, like we've kind of discussed, is, a lot of people, aren't aware of it. Is that in maybe like I don't know, let's do a time capsule, maybe 3 to 5 years' time, what would you like for the more broader society or people in the professional medical industry world like to know, or would you like more freedom to be a doula or more communication, more knowledge to be shared?
Yeah.
And is that the big barrier?
Yeah, I mean, I work at a hospital and there was a position on the birthing suite and I was told that I couldn't have that position because it was a conflict of interest because I was a doula, when it's like when you have like ENs at work but they're studying to do their RNs off, do you know what I mean?
Yeah.
So
Enrolled nurse and registered nurse, yep.
So it's like it just kind of made me realise the lack of knowledge in the medical industry. That's basically what I was getting at. So I think there's a lot more. We're doing better. We're definitely doing better. Like they've started having the Strength to Progress conference every year and talking about different, topics around birth, and that's, GPs, midwives, doulas, and it's a whole collective. But I definitely think there needs to be a lot more education and of doulas within hospitals, and a more collaborative approach for sure. Yes.
And I just wonder if the lack of knowledge or the lack of awareness, I wonder if that's just here in Australia or is it just universal?
I'm not actually sure.
Yeah,
I don't actually know, but I know definitely that I've had friends who work in the UK and they've actually worked on the birthing suites, and basically they would work closely with the babies and provide that support and that kind of thing. So no, I'm not actually sure.
I mean, it could be. It could be just an Australian thing where, we're a little bit behind the times, which is not unusual. We have been behind the times in many different things. All right. Now, what's one thing, if you could say, one thing about being a doula, what's one big inspiring thing for you Is it?
The opportunity to connect with women
Yep.
and provide safety for them and to hold space for them and just to make them feel held. Every woman deserves to feel held.
Yep.
In those early days, in that postpartum. Every woman deserves to feel held, and it is not a luxury. It's something that, it should be a non-negotiable.
Yep.
It should definitely be a non-negotiable. Yeah.
And do you think, I know, do you think, though, that very early stage, is that the most crucial part for you?
I think so.
Yeah.
Yeah, definitely. Because it's, I think we get lost in those early days and we don't realise that it's normal to be sleep deprived. It's normal to, not know what's going on, and we get into this mindset of comparing ourselves to other women and should my baby be feeding this many times?
Yep.
Or like, why is my baby not sleeping through the night? They're a baby, they're not supposed to,
Yep.
And, why am I feeling glum? Like I remember with my twins, it was, I don't know, maybe day 3 or day 4, and I rang my mum and I was crying and I said to my mum, "Are you coming in?" And she said, "Yes." And I said, "Good," because I was so upset. And we were working so hard to get the twins to gain weight,
Yep.
and they weren't gaining weight, so we couldn't be discharged. And so I remember I'd put I was putting affirmations on my on the whiteboard, like I had from little things, big things grow, and
Yep.
things like that. And the midwife came to me and she said to me, "Have you been outside today?" And I said no, because my sole focus was being with
Yep.
those babies. So I had not even had fresh air in 3 days. I had not left that hospital room in 3 days. And I went outside and I walked my mum to the car and I came back. So let's say you had a postpartum doula come into your home. It may be that, if the woman feels up to it, you guys just go for a stroll around the block.
Yep.
And get some fresh air. The mother may have not thought to do that, the doula being able to read that situation, being to read what the mother needs. Because I know even now I've got a 7-year-old and 4-year-old twins, and I still have to remind myself, make sure you eat your lunch, go outside, get fresh air,
Take a break.
Yeah, exactly. And so when you're in the midst of those postpartum period, when you're sleep deprived, when you're tired, when you're looking after this baby, so you put that baby before yourself, which is natural. That's that natural instinct, It's to have that person come in and hold the mother. So the doula's job is to hold the mother. The doula's job is to hold that baby.
Yep.
And go, "Here, give me the baby."
Yep.
The doula's job is to hold the mother. Yeah.
Now, before we go, is there any last point or something that you'd like to raise?
Oh, just that, that everybody deserves to be held during birth. Everyone deserves to have the opportunity to have a positive birth.
Yep.
And whether that's, if you go on Instagram, there's so much information out there. There's like Jessie the doula. She's got plenty of like free workshops and things like that. There's every woman deserves to have a birth where she is feeling safe and held, has that continuity of care, and has that open communication. Yeah. We want to make sure that we can bring down, this 1 in 3 that's happening with the birth trauma. I mean, so King Eddie's is currently about to do a birth inquest into birth trauma. They're doing them around all the states, and and it it's really something close to my heart. So it's something I'm really passionate about reducing that, you know, and so if there's anything I can do to help reduce that and make sure that women feel safe and held and centred in their birth, bring it on, I'm here for it. So something I'm really passionate about that I really want to raise is birth trauma. So when I came into this world, it was quite traumatic. I lost my twin sister at 2 months. And so I entered this world feeling abandoned. Every birthday we would go to my twin sister's grave and we would put flowers on her grave. We would stand there. No one would really say too much. You know, we'd respectfully stand there. My parents might have spoken a little bit, but there was no real emotion, nothing, and we would leave. And I think as a young child, I felt really powerless because I didn't know what to say or what to do and how to fix it or make it better and help my parents in that grief. And, you know, I spent a lot of my life questioning my significance in the world, why I was here, why my twin sister wasn't, you know, trying to prove my self-worth, you know, trying to prove myself that I was good enough to be in this world. And I think a lot of the part, perhaps feeling like a failure. And if you look at the themes of birth trauma, the 5 themes of birth trauma are abandonment, powerlessness, insignificance, failure, and threats to safety. So going into my birth, well, if we rewind, at 20 I was diagnosed with epilepsy. So I had a seizure and basically I had continuous seizures for many years. And again, it's that feeling powerlessness, like your body's failed you. So when I went into my birth, I not consciously carried that trauma into my birth. I didn't feel like my body was going to do what it was supposed to do. I didn't feel like it was going to be able to give birth. I think I felt if I gave birth naturally, I would be able to heal my parents' trauma because it was such a traumatic birth for them having me. So I had built up this unimaginable expectation. It was not going to be achieved. So if I had hired a doula, we would have been able to talk through all of this, work through all of this. You know, they would have spoken to me about what anxieties have you got, what fears have you got. I probably would have spoken about, you know, I don't think I'll be able to do this. I think it should be a C-section. They probably would have said, why do you think it should be a C-section? Those doubts would have come up. So I went on. I had an emergency C-section. When I went and did my doula training and I learned about birth trauma, I was floored. I was absolutely floored. I'd never heard about birth trauma. I had a son and 2 little baby twins, and I'd gone all this time not even knowing about birth trauma. And 1 in 3 women experience birth trauma. That can be prevented by having a doula and by having that continuity of care. So it's it's been a lot of reflection for me, and it's been a full circle moment for me. If anyone wants to find any resources, Fiona Rogerson has an array of resources on her Instagram.
Yep.
She is constantly posting content on there, and it is phenomenal in validating women, and also a place where women can seek help if they need to. I know it is something that I did. I seeked help for the past year and a half. But this is something I'm really passionate about ensuring that women feel safe and women feel held, and women know that they can go into birth feeling empowered. And if you have had things happen in your past, that's okay. You can move through the fear, and we can work ways around it and work out what is the best way for you moving forward so that you can have the best birth imaginable possible for you.
Mm. And I think that's really important because, like we talked before, the fear can hold you back as well.
Yeah.
Excellent. Well, Stacey, it's been an absolute pleasure chatting to you. Thank you so much.
Thank you so much, David. I appreciate it.